If you've recently been told your bone density is dropping, maybe you've just been diagnosed with osteopenia or osteoporosis, I need you to stop what you are doing and listen very closely, because that innocent morning stretch you've been doing to stay flexible could be quietly, permanently cracking your spine. Millions of seniors think touching their toes or doing crunches is the ultimate key to staying young and mobile. But in my clinic, I've seen those exact, traditionally healthy movements cause permanent, irreversible spinal damage in less than a second. Hi, I'm Dr. Marcus. I'm a physical therapist specializing in geriatric orthopedics and bone density health, and today, we need to have a very serious conversation about your morning routine. By the end of this video, you are going to know exactly which 3 popular stretches you must immediately ban from your routine if you have bone loss. I am going to show you the hidden mechanical forces that literally crush weakened vertebrae from the inside out. Most importantly, I'm going to give you 3 highly effective, bone-safe alternative movements so you can maintain your mobility, strengthen your core, and keep your independence without risking a devastating fracture. Before we get into the anatomy of what's happening to your back, I want to hear from you. Tell me in the comments below, what's the very first stretch or exercise you do when you roll out of bed in the morning? Let me know down there, because after this video, you might just be changing that answer. Let me tell you about Margaret. She's a patient of mine, a 71-year-old retired school teacher living up in Madison, Wisconsin. Margaret is a fighter. About 6 months ago, her doctor told her she had osteopenia, the precursor to full-blown osteoporosis. Like any proactive person, Margaret decided she wasn't going to take this lying down. She wanted to stay independent. She wanted to keep working in her beloved garden, and she wanted to stay young. So she doubled down on her flexibility. Every single morning, Margaret would roll out her yoga mat in her living room. She believed, like so many of us are taught, that a flexible spine is a healthy spine. Her favorite move? The classic seated toe touch. You know the one. You sit on the floor, legs straight out in front of you, and you reach as far forward as you can, rounding your back to grab your toes and holding it for 30 seconds. One Tuesday morning, Margaret was doing exactly this. She took a deep breath, rounded her spine forward, reached for her sneakers, and felt a sudden, sharp pinch right between her shoulder blades. It wasn't a muscle tear. It didn't feel like a normal strain. It felt like a deep, structural ache. Now, Margaret is tough. She assumed it was just a muscle spasm. Maybe she slept funny, or maybe she just pushed the stretch a little too far. She tried to rub some heat ointment on it and go about her day. But over the next 2 weeks, that sharp ache didn't fade. It turned into a constant, exhausting, band-like pain wrapping around her ribs. It hurt to cough. It hurt to laugh. It hurt to simply bend over the sink to do the dishes. When she finally came into my clinic and we sent her for an X-ray, the image showed exactly what I had feared. Margaret hadn't pulled a muscle. She had suffered an anterior wedge compression fracture in her T11 vertebra. By trying to keep her spine flexible, she had literally crushed her own bone. What happened to Margaret is something I see happening across the country every single day. We are caught in a hidden trap of healthy habits. You see, the fitness industry, magazines, and even well-meaning doctors constantly tell seniors to keep moving and stay flexible. And that is good advice, in theory. But the fatal flaw is that the flexibility routines you see on TV or the stretches you learned in gym class back in the 1970s were designed for young, dense, 20-year-old bones. They were not designed for a skeleton that is actively losing its structural integrity. When you have osteopenia or osteoporosis, the internal architecture of your bones starts to look less like a solid piece of oak and more like a fragile honeycomb. The outer cortical shell gets thinner, and the internal trabecular struts weaken. Now think about your spine. Your spine is made up of blocks of bone stacked on top of each other. When you stand up perfectly straight, your weight is distributed evenly across the thick, strong back and middle parts of those bones. But what happens when you do a toe touch? What happens when you do a sit-up to strengthen your core? You are performing what we call in physical therapy spinal flexion. Spinal flexion is simply the act of rounding your back forward. And when you round your back forward, you take all the weight of your upper body, you add the downward pull of gravity, and you add the intense pulling force of your own tight muscles, and you shift all of that pressure directly onto the very front edge of those fragile, honeycomb-like bones. It acts exactly like a heavy-duty nutcracker, and if your bone density is low, that front edge simply cannot handle the pressure. It compresses. It pancakes. It fractures silently, often without a major fall, without a stumble, and without any obvious trauma. And the worst part of a compression fracture? Once that bone compresses into a wedge shape, it never, ever pops back up. It permanently alters your posture, shifting your center of gravity forward and leading to that hunched appearance we call kyphosis, or a dowager's hump. This creates a vicious cycle where your head is pulled further forward, putting even more pressure on the next vertebra down the line, setting you up for a cascade of future fractures. This is why we have to completely rethink what healthy movement means as we age. We have to separate muscular stiffness from bone vulnerability. Because right now, millions of you are diligently performing 3 specific exercises every morning that are a direct fast track to a spinal collapse. I need you to fully grasp the biomechanics of this crush fracture, and more importantly, I need to show you the 3 banned moves you must stop today, and what you should be doing instead. To truly understand why these exercises are so dangerous, we have to look closely at the architectural changes happening inside your body right now. If I were to show you a cross-section of a healthy 30-year-old vertebra under a microscope, it would look incredibly dense. It has a thick, hard outer shell called the cortical bone, and inside it's packed with a thick, interlocking web of bone tissue called trabecular struts. It looks like a dense, heavy-duty sponge made of solid calcium. But when osteopenia or osteoporosis sets in, that architecture changes dramatically. The thick outer shell becomes eggshell thin. The dense inner web starts to lose its connective struts, leaving large, empty gaps. The bone doesn't just get lighter, it becomes mechanically fragile. Now, imagine taking a rigid, empty cardboard box and pressing down evenly on the top with both hands. It can probably hold your weight pretty well, because the pressure is distributed across all 4 walls. That is what happens when you stand up straight with good posture. But what happens if you tilt that box slightly forward and put all your weight on just the front top edge? The front of the box immediately crumples, folds in on itself, and collapses. That is exactly the biomechanical reality of spinal flexion. When you round your back forward, you are shifting the entire weight of your upper body, the downward force of gravity, and the extreme tension of your own muscles directly onto the fragile front edges of your vertebrae. This brings us to the very first movement you must ban from your routine, the straight leg toe touch. It doesn't matter if you are sitting on the floor or standing up. Reaching for your toes with straight legs is the #1 cause of flexibility-induced compression fractures I see in my clinic. Most seniors do this because they want to stretch their hamstrings, the large muscles on the back of the thighs. But here is the biological catch. As we age, our hamstrings naturally get very tight. When your hamstrings are tight, they essentially lock your pelvis in place. So, when you try to reach your toes, your pelvis can't pivot. To make up the distance, your body forces your middle and lower spine to aggressively round forward. You aren't actually stretching your legs anymore. You are forcefully bending your spine under immense tension. You are taking that cardboard box, tilting it, and crushing the front edge. If you have bone density loss, touching your toes is simply not worth the risk to your spinal column. The second banned movement is one that catches so many proactive, health-conscious seniors completely off guard. The traditional sit-up, or the floor crunch. I want to tell you about Gary. Gary is a 68-year-old retired mechanic living in Grand Rapids, Michigan. Unlike Margaret, who had a sudden, sharp injury, Gary's story is what we call a silent collapse. Gary had been dealing with a nagging, achy lower back for years. A well-meaning friend told him that the secret to fixing a bad back was to strengthen the core. So Gary took that advice to heart. Every single morning, he got down on his bedroom rug, locked his hands behind his head, and did 30 traditional sit-ups. Gary didn't feel a sudden snap. He didn't end up in the emergency room. But over the course of about 4 months, he started noticing strange changes. He realized he had lost over an inch of height. His shirts were hanging differently on his chest. His stomach seemed to be pushing outward, even though he hadn't gained weight. And that nagging lower back ache had migrated upward, settling into a deep, heavy, constant, dull pain right in the middle of his back. When Gary came to me, we got an X-ray. He hadn't just fractured one vertebra. He had micro-fractured 3 of them in a row. You see, a sit-up is nothing more than repetitive, forcefully loaded spinal flexion. Every time Gary crunched his shoulders off the floor, his powerful abdominal muscles violently pulled his ribcage down toward his pelvis, forcefully crushing the front of his vertebrae together. He thought he was building a shield of muscle to protect his back, but because his bones were softened by osteopenia, his own muscles were acting like a vice grip, slowly micro-fracturing his spine day after day. Only about 1 in 3 spinal compression fractures are ever formally diagnosed, precisely because of cases like Gary's. People just assume the dull ache is old age or muscle soreness, completely unaware that their spine is actively collapsing. This leads us directly to the third band movement: deep, loaded spinal twists. Think about the seated twist machines you see at the gym, or those aggressive yoga stretches where you sit on the floor, cross one leg over the other, and use your elbow to crank your spine as far around as it will go. Your spine is designed to twist, yes. But when you combine twisting with any amount of forward bending, which almost always happens when we sit down, you create a massive shearing force. If spinal flexion is like a nutcracker, a loaded spinal twist is like wringing out a dry, brittle sponge. The rotational force shears those fragile inner trabecular struts right in half. If you have low bone density, aggressive twisting is a recipe for disaster. By now, you are probably feeling a little frustrated. You might be sitting there thinking, Dr. Marcus, if I can't bend forward to stretch my legs, and I can't do sit-ups to strengthen my stomach, and I can't twist, how on earth am I supposed to stay active? How am I supposed to pick up my grandkids, or tie my shoes, or get out of bed? That is the exact right question to be asking, and it is the exact conversation you need to have with your own healthcare provider. In fact, at your next doctor's appointment, I want you to take a pen and write this exact question down to hand to your physician or physical therapist. I have low bone density. Can you help me build a flexion-free core routine that protects my spine? I want you to use that specific medical phrase, flexion-free. When you use those words, you are telling your doctor that you understand the biomechanics of your own body. You are telling them that you refuse to accept standard, outdated advice, and that you demand an exercise protocol that keeps your spine in a safe, neutral position. But you don't have to wait for your next appointment to start protecting your back. Because the secret to staying young, active, and mobile with osteoporosis isn't to stop moving entirely. The secret is to learn how to move the way your skeleton was actually engineered to move in the first place. You need to replace those dangerous stretches with movements that build functional, real-world strength without ever putting a single ounce of crush pressure on your vertebrae. And that is exactly what we are going to do right now. Let me show you the 3 safe, highly effective alternatives you should be doing instead. The very first alternative movement we need to master is the absolute foundation of bone-safe mobility. It completely replaces the dangerous toe touch, and it is called the neutral spine hip hinge. When you do a toe touch, you are forcing your spine to bend. A hip hinge, on the other hand, teaches you how to bend forward by keeping your spine completely rigid and using your large, powerful hip joints as the pivot point. To learn this safely, I want you to go into your kitchen and grab a standard broomstick or a Swiffer pole. Hold the broomstick vertically behind your back. I want you to make sure the stick is touching 3 specific points on your body: the back of your head, the space right between your shoulder blades, and your tailbone. As long as the stick is touching those 3 points, your spine is in a safe, neutral alignment. Now, keeping your knees just slightly bent, I want you to push your hips backward. Imagine you have a bag of groceries in your hands and you are trying to bump your car door shut with your backside. As your hips go back, your torso will tilt forward. If you start to round your back, the dangerous flexion we talked about, the broomstick will immediately lift off your tailbone. That is your physical alarm bell. If you lose that point of contact, stop, stand up, and reset. The hip hinge allows you to stretch those tight hamstrings safely and pick things up off the floor without putting a single ounce of crush pressure on the front of your vertebrae. This isn't just an exercise. This is how I want you bending over the sink, brushing your teeth, and loading the dishwasher from this day forward. The second alternative movement is the ultimate replacement for sit-ups and crunches. It's called the bird dog, and it is a phenomenal way to build a protective corset of muscle around your middle without ever flexing your spine. I recommend putting down a thick, soft yoga mat or a folded blanket to protect your knees. Get down on all fours, with your hands directly under your shoulders and your knees directly under your hips. Imagine your back is perfectly flat, like a sturdy coffee table. You don't want your belly sagging toward the floor, and you don't want your back arched up like an angry cat. You want a stiff, flat line. From this position, I want you to slowly slide your right arm forward and your left leg backward until they are parallel with the floor. The biggest mistake people make here is trying to lift their arm and leg as high as possible, which forcefully arches the lower back. Don't do that. Reach for length, not height. Imagine trying to touch the wall in front of you with your fingertips and the wall behind you with your heel. Hold that extension for 3 seconds, bracing your stomach, and then slowly return to the starting position. Alternate sides. This movement engages your entire core, strengthens the small stabilizing muscles along your spine, and completely bypasses the nutcracker effect of a traditional sit-up. Finally, we need a safe alternative to replace those aggressive, loaded, twisting stretches. Because we spend so much of our modern lives rounded forward, driving, looking at phones, sitting in recliners, we need to actively promote safe, gentle spinal extension. The best way to do this is with the standing wall press. Stand facing a wall, about 1.5 feet away. Place your forearms flat against the wall, with your elbows right at shoulder height. Keeping your chin tucked slightly, I want you to gently press your chest toward the wall, allowing your shoulder blades to squeeze together in the back. You should feel a wonderful opening stretch across your chest and the front of your shoulders, while the muscles in your upper back engage. You are gently reversing the kyphotic curve, the hunched posture, without putting sharp, shearing forces on the lower back. Hold this for 20 to 30 seconds, breathing deeply. If you can swap your toe touches, your crunches, and your aggressive twists for the broomstick hip hinge, the bird dog, and the wall press, you will fundamentally change the trajectory of your spinal health. Let's go back to Margaret. After we identified her T11 compression fracture, she was terrified. She thought her gardening days were over, and she was scared to even bend over to tie her own shoes. We had to put her in a supportive brace for a few weeks to allow the microfracture to stabilize, but more importantly, we had to completely retrain her daily movement habits. We threw out her old yoga routine. We spent hours practicing the dowel hip hinge until it became second nature. I taught her to never bend down to tie her shoes, but instead to bring her foot up to a stool, keeping her spine straight. Today, Margaret is back out in her Wisconsin garden, but she doesn't bend from the waist anymore. She uses a thick kneeling pad, and when she needs to reach for a weed, she hinges perfectly at the hips. She is pain-free, her core is stronger than it has been in a decade, and she is fully confident in her body again because she understands exactly how to protect her bone density. You can have that same confidence, but it starts with the choices you make the minute you wake up tomorrow morning. Before you go, I want to know exactly what action you are taking away from this video. Let's make a commitment right here in the comments. Comment starting today if you are throwing out the sit-ups and toe touches and swapping them for the hip hinge and the bird dog. Comment asking my doctor if you are going to write down that question about a flexion-free core routine and take it to your next physical or bone density scan. And comment sending this if you know a friend, a spouse, or a parent who is desperately trying to stay flexible but might be unknowingly putting their spine at risk. Send this video to them right now. If you want a printable cheat sheet of everything we talked about today, make sure you click the link in the description below to download my free PDF guide, Spine Safe Daily Movements. It has pictures and step-by-step instructions for the exact routine I use with my patients. Please hit that subscribe button and turn on notifications so you never miss a video that could save your joints. I'm Dr. Marcus. Remember, your spine is designed to last a lifetime, as long as you treat it right. Keep moving, stay safe, and I will see you in the next video.